Sudden shortness of breath is a symptom that should never be ignored. It can have multiple causes, ranging from simple issues to serious medical emergencies. Common causes include asthma attacks, severe allergic reactions, respiratory infections such as pneumonia, and even choking. Heart problems, such as heart attacks or heart failure, can also trigger this sensation. Pulmonary embolism, which is the blockage of an artery in the lung, is another serious cause that requires immediate attention. Anxiety and panic attacks can also cause sudden shortness of breath, but it is always important to rule out physical causes first. If you experience this symptom, seek medical attention immediately, especially if it is accompanied by chest pain, dizziness, or bluish lips. The sooner the cause is identified, the higher the chances of safe and effective treatment. Coughing is a common symptom, but when it persists for more than 3 weeks, it deserves special attention. A cough that doesn't go away may indicate more serious respiratory infections, such as pneumonia or tuberculosis. It can also be related to poorly controlled asthma attacks or chronic bronchitis, common in smokers. Another concerning cause is lung cancer, especially if accompanied by blood, weight loss, or chest pain. Persistent dry cough can also signal allergies or even gastroesophageal reflux. If the cough comes with fever, shortness of breath, or wheezing, see a doctor as soon as possible. Early diagnosis makes all the difference in treatment, preventing more serious complications. Don't ignore your body's signals. A cough that doesn't improve deserves thorough investigation.